Hello everyone, introduce myself. My name is Duna Alqaeda from the Faculty of Industrial Engineering. Okay, here I will present a text entitled Healthcare. Okay, one first. What is implicit bias in healthcare? In healthcare, implicit bias can shape the way medical providers interact with patients because everyone is susceptible to implicit bias. Even clinics, this unconscious perception will naturally seep into patient-provider communication. Healthcare professionals should provide impartial care to every patient. However, some people may receive varying level of care as a result of the bias of healthcare staff and medical research. Bias and discrimination are both of interpersonal and the intentional level of healthcare. Bias can lead to people receiving poor treatment, receiving incorrect designations, or experiencing delays in diagnosis. It can also lead to stress, which can worsen health conditions. And two, explanation of bias. The word bias refers to a negative or positive idea a person has about someone or something. A person bias can affect how they interact with people of certain groups. An implicit bias is a bias that a person is unaware of. A person who has an implicit bias might believe they treat everyone equally. However, the person implicit bias may cause unconscious negative association toward certain group of people. And three, recycled groups. The 2019 National Healthcare and Discrimination Report found that white patients were more likely to receive better quality care than one black patient, two Native American patient, three Alaska Native patient, and four Hispanic patient, and five Native Hawaiian patient or Pacific Islander patient. Racial bias in healthcare can lead to black, indigenous, and people of color having a harder time accessing healthcare. This can mean a person of color has the least in treatment, leading towards outcomes. 1. Sex and gender. Sex and gender bias can cause people to feel ashamed or silent when it comes of their health condition. This can mean that a person will avoid seeing their doctor, leading to delays in treatment. This bias also applies to transgender people. Transgender people may be reluctant to receive healthcare because they have concern about being unfairly or improperly treated. 2. Sexual identity. Perceived discrimination from healthcare professionals can contribute to LGBT people avoiding treatment. Researchers from the same 2019 study notes the avoidance of healthcare is part of the reason LGBT people have higher rates of anal cancer, cardiovascular disease, and asthma. 3. Age. Healthcare professionals are more likely to assume the older adult will be 1. Unwilling to receiving treatment, 2. Upsize, 3. Helpless and demanding. The study also notes that some healthcare professionals be less likely to recommend older adults. They may feel that is a more compassionate choice. However, missing out this treatment can result in lower quality of life for all the others and possibly cause death. 4. Overweight and obesity. Healthcare professionals can view people with obesity as 1. Lazy, 2. Weak willed, 3. Lacking self-control, and unwilling to follow recommendations. Unlikely to stick to treatment, healthcare professionals were also prone to attributing a person's symptoms to their obesity. A healthcare professional may therefore recommend that a person lose weight rather than providing treatment of the condition. 6. Education. A person's level of education can evaluate their level of health. Research from the 2018 noted the people with lower levels of education report 1. Worse general health, 2. More chronic condition, and 3. More limitation and disability. 7. Geographic location. Where a person lives can evaluate how the healthcare professional treat them. 1. Be older, 2. Lack health insurance, and 3. Be less likely to have higher education. Geographic location also play an important role in many social distribution of health. Some examples of how implicit bias play out in healthcare care include 1. Non-white patients receive favored conditional intervention and favored renal transplant. 2. Black women are therapy and radiation therapy for prostate cancer and more likely to have the cyst removed. How to overcome bias in healthcare? The question that can help reduce bias in healthcare include 1. More education on health dispersion, 2. Positive and frequent group contact with different historically marginalized groups, 3. Providing patients with a less clinician to act regarding their condition, which can lead to extended and more in-depth conversation with their healthcare professional. 3. Understanding and respecting the magnitude of incarnation bias. 4. Recognizing situations that magnify stereotypy and bias. Summary. Many bias can exist in healthcare. People from historically marginalized groups may be subject to unfair prejudice that stem from healthcare professional implicit bias. Healthcare professionals should be aware of any bias to have and work in overcoming them. People can work on their healthcare bias through various methods, such as working with people from historically marginalized groups and seeking education of health disparities. So many questions from me. I hope it was useful. Thank you and see you the next video.